Hi, I'm Catherine Bertram, Senior Social Behavior Change Advisor with Johns Hopkins Center for Communication Programs and the READY Initiative. I'm going to talk about how you can use a pathways model to think through and adapt risk communication and community engagement programming during COVID-19. So this session is a focused review of this model. So while this socio-ecological model was covered in the introduction to risk communication and community engagement session, this is just a very brief refresher because it relates to this session. This model illustrates drivers of behavior within different levels, showing that what happens around us matters when it comes to our decisions. The levels in a socio-ecological model usually include individual, family peer, community, service, and structural. So we can consider these drivers and plan accordingly to create an enabling environment for the uptake of optimal behaviors. We're many months into the response now, so I want to share with you this planning tool that can help you think through considerations that may lead to adaptations to your programming. This pathways model is a framework that describes processes and effects across different levels, like we've just seen. The columns in the model represent a rough progression of stages from the current conditions or challenges in which our responses are being implemented to a future vision, usually, but not always, of societal health. It's important to note that the pathways model was never meant to depict a strictly linear process, and so doesn't represent all the many sequential, reciprocal, or iterative changes that might happen in a messy real world. Instead, the model shows the indirect effects on impact through enablers and intermediate effects. The point is to think through this information when contemplating changes to strengthening an approach. So I'll go through this model column by column to give you a better sense of how this works. We start by identifying the current situation in which your programming is being carried out, which may have changed since you first began the response. So what are the important elements we need to understand? Let's start at the community and individual level. This might mean having an understanding of those community structures and support systems and services, those key relationships and partnerships that enable an ability to engage and inform. At the service level, and we can define this in terms of health and/or humanitarian services to communities, this might mean having an understanding of those service coverage gaps, human and financial resources, and response capacity in this context. At the structural level, we'll want to know the policies and measures in place and the political, environmental, and humanitarian context, as this may affect the ability of communities to comply or trust information. Of course, we'll want to know the epidemiological data to show where we need to prioritize our interventions and to what audiences. Another contextual factor can be how the economic situation is affecting the people's behaviors and the response. So what are the domains of communication at each level? This column identifies common communication processes and systems at different levels. So for example, at the community and individual level, what communication systems and processes do we need to consider in our context? So for example, those community structures and community leaders and networks, feedback systems and processes like parent-child communication. And then at the service and structural level, this can be everything from feedback systems, guidelines, trainings, job aids for service providers, policies and protocols, and coalitions. Here, we reflect on changes at each level to create a more supportive environment for behavior change. By creating a more supportive environment with more competent services, more engaged and supportive communities, and more informed and engaged individuals in those communities, the likelihood of proactive positive behavior is increased. What individual drivers do we need to consider, like emotion and value, beliefs, attitudes, perceived risk, perceived severity of the disease, and self-efficacy or the confidence and skills to take protective action? Health literacy, do people understand what the virus is? And media literacy, in other words, the ability to discern misinformation from credible sources. In the community, here we might look at competencies in community leadership for community-led approaches and more equitable participation. We might look at social norms related to optimal and safe practices. So here's another place where theories are important to understand how to influence social norms. And then collective efficacy, or that belief that the community has the power to act. And then functioning community support systems. At the service level, a more enabling environment, of course, means access and availability of services and a functioning referral system. An enabling environment also includes technical and operational competence of workers and communication skills, so that important interpersonal communication skills for service providers. And then maybe the integration of services also create that more supportive environment. So what about in the environment? So again, individual and community compliance and resilience can be enabled when we have political will, policy change, resource allocation. So for example, resources to communities to be supported in addressing community issues to compliance. In one country, the Risk Communication and Community Engagement Working Group was receiving a lot of data showing violence against health workers. So as part of their recommendations to the ministry, they advocated for laws and programs that would protect healthcare workers. All of their recommendations, in fact, included not only individual and community level behavior change recommendations, but also those system level recommendations. So particularly when there are shorter timeframes or limited funding, programs may produce changes or outputs that stop short of ultimately desired outcomes. So for those programs, something that might be an intermediate effect, so for example, improved local media engagement and coverage of public health measures or other services, that's an outcome if it's the goal of the program, even though it will ultimately contribute to a more informed public and a more accountable government. In a larger, longer program, the output of media engagement might be more explicitly designed to contribute to the program outcome of a better informed public and a more accountable government. So within this column, more than in the others, it's likely that actions at one level have influence on actions at another level. So for example, changes in actions at the policy level may influence actions within the service level. So for example, policies or laws that protect healthcare workers will have an effect on healthcare services. And then actions by individuals who access those services, which may be increased demand. So similarly, actions at the individual or community level, such as non-compliance to public health measures, may affect policy decisions made by political leaders. So at the individual level, we can measure the effects of our risk communication and community engagement in terms of people practicing social distancing and personal protection in the household and community. It may also be uptake of other behaviors like nutrition or education. Intermediate effects for community action may be demonstrations of community ownership, community-led solutions, and community resilience. It may be compliance with guidelines and effective containment or completion of community action plans, as an example. On the service side, these may mean more defined service provider roles and responsibilities, strategic messaging and trained staff, more effective service provider communication, so service providers who have adopted those risk communication and community engagement principles. And then at the structural level, we can look at engaged leaders, engaged media, and engaged NGOs and other humanitarian actors, and possibly adapted policies that are clearly and consistently communicated. So for impact, again, these are the in this case, these are the population level outcomes related to responsiveness and impact on COVID-19. So that may be increased coordination. It may mean timeliness of services or community mitigation and reduced morbidity and mortality. So key takeaways for this session. Using a pathways model can help you more strategically plan and refine your risk communication and community engagement planning in a short or long term, linking context to competencies, actions, outcomes, and impact. Additional considerations: behavior change can be challenging, if not impossible in some circumstances, without fostering an enabling environment. So I hope you've enjoyed this session.